Thank you very much for joining us today on the program, Healthy Living. It's a big month for us. September is usually a very big month for us here. And so this program is coming on a little bit late due to that. Let me quickly use this opportunity to say a very big congratulations to our CMD, Chief Dr. Gabriel Usawa Igbenedion, as he turns 85. May God continue to be with you, grant you long life, and in good health. Today on Healthy Living, we shall be looking at urinary tract infection. And I have a doctor in the house, Dr. Jolly Nosa Iguma, the CMD Journals Medical Center here in Benin City. And we're going to quickly look at a UTI, as it is popularly called. What are the causes? What are the symptoms? You know, what are the risks? The risk that may occur if you do not treat it, and how do you diagnose? All of this we're going to be doing today on the program. Dr. Jolly, it's nice to have you join us today.
Thank you for having me.
Okay,
Good
quickly,
viewers.
Time is not our friend. Let's quickly look at what urinary tract infection is.
Yes, urinary tract infection is the multiplication of a bacterial organism within the urinary tract. And if we look at the urinary tract, we have to start from the kidney. The kidney is a very vital organ in the human body for the fact that it plays a role in catabolism, that is the breakdown of food substrates, even drugs and the fluid that we take. Considering a large molecule like a protein, the kidney, we have to convert it into ammonia, into urea and creatinine, and also nucleic acid into uric acid. So the kidney is the first organ in the urinary tract. The others include the ureters, which connect the kidney down. They will now have the bladder, which is like a temporary storage of urine before one will now feel that urge to urinate. Then in the lower part of the bladder, there is this urethra. So when any of these organs is affected by microorganisms, usually the bacteria, whether the kidney, whether the ureter, whether the bladder, whether the urethra, then we see that there's a urinary tract infection. And other than the symptoms that might come up as a pointer to urinary tract infection, we also believe on laboratory reports. We will say there's a urinary tract infection if we are able to isolate 10 raised to power 5 coloniform units of organism in 1 ml of urine.
That's when you go to the lab.
When we go to the lab, yes.
Okay, so how do you self-diagnose?
Yes, when there are symptoms, many a times you see that urinary tract infection is even a disease or an infection that can be reported by the patient himself or herself because of the related symptoms that are familiar to them. There are certain organisms that are responsible for this, which are the bacterial cause. Okay. Considering the fact that, just the way I was trying to explain, that the kidney plays a role in production of urine. So the urine tends to act as a medium for the growth of bacteria. And anything that is capable of causing obstruction or stasis or cause outlet or difficulty in passing urine, there will be build-up of microbes in the urine, thereby causing urinary tract infection. So you can see that if at any point in time that there is an obstruction within the channel, maybe the ureter, there's a stone there that will cause the urine from trapping down. Somebody might be predisposed to urinary tract infection. So
let's look at somebody who may be suffering from urinary tract infection without knowing. How would the person know? What are the signs? What are the symptoms?
Yes, the symptoms of the urinary tract infection include increased frequency of urination. Many a times in our environment, when persons begin to pass urine frequently, they tend to look at the endocrinology, pathology aspect of it, usually the diabetes, but it's not always so. Increased urination might be as a result of urinary tract infection. It might also be as a result of diabetes insipidus. even some prostatic enlargement, what we call the benign prostatic hyperplasia, you know, in the case of...
Do you have to break that down for us, please?
You know, the male
Yes.
has a prostate, just like as I was talking about the urethra, which is the last part of the urinary tract. So the male has a, you know, two structure attached to the urethra, but this one is absent in female. That one actually makes female to be more predisposed to urinary tract infection.
So the females are more predisposed to
yes,
urinary
for the reason that
tract
you don't have the prostate. The prostate tends to
the
produce a bactericidal agent other than the lipids and phospholipid it produces as a part of the semen production. The female also has this short urethra. So, like the symptoms as I was saying, somebody that has a urinary tract infection will experience increase in urinary frequency. The person might pass urine up to 4 or 5 times a day. Even at night, he or she might, you know, wake up at night to pass urine. It does not mean that the person is diabetic. Okay. You can see the role that the laboratory will have to play.
Exactly.
Other than the increase in frequency of urination, there is this unpleasant sensation within the urethra. Okay. Where the urine comes out from.
Both men and
in both men and women, they feel this unpleasant pain. We call it dysuria. That painful urination is there. And not only that, there can also be passage of a cloudy urine. The urine is cloudy or even offensive for a patient that has a urinary tract infection. Okay. And in most cases, they might also have lower abdominal pain. But the lower abdominal pain is not too common. Okay. But if in the case of, because the bacteria usually moves from the lower part to the upper part. And the urethra is usually the first part where the microorganism will have to invade. Usually the tubular layers of the urethra.
Doctor, you know that we are not doctors, and all these big words, if you can just, you know, cut them bit by bit so that the layman out there will understand what we're talking about today on the program.
That, like a female that are usually more predisposed to urinary tract infection, we shouldn't forget that World Health Organization has made us to know that 1.5 million persons comes down with urinary tract infection every year.
And out of that 1.5, how many percent is women?
More than 80% are women. Because of the fact that their anatomical structure, their urethra is in the perineum close to the anus. The microorganisms that are responsible for this urinary tract infection are normal flora in the gastrointestinal tract. That is the stool. The stool that will pass out, they are just normal flora. It does not have anything to do with the genital tract, as the case may be. We just pass it out, those microorganisms. But when those microorganisms find their way into the urethra, it becomes effective. You can see, like the women that are, as I was trying to say, for the fact that the urethra is close to the anus, considering the perineum, you can see that that is why they are more predisposed.
So cleanliness is very important.
Hygiene is very important in prevention of urinary tract infection. Other than that, there is this intense desire to urinate, what we call the urgency. Somebody with urinary tract infection might not be able to completely empty his or her bladder. They pass urine. There's still this urge to urinate. There's this urge to urinate. So that is a symptom of urinary tract infection. And there can also be fever. Many times, if there is a vesicoureteral reflux, what it means is that if the bacteria in the bladder begins to move upward to the extent that it's not causing complication, maybe the kidney is not affected. We might have what we call the acute pyelonephritis. In that case, the person might not even feel pain only in the frontal part of the abdomen. They might also feel pain at the back. You know, it could also be bilateral because the kidney is just
it's not every back pain that's related to
it's not every back pain. And the person might even come down with nausea and vomiting. In that case, we say, okay, there's acute pyelonephritis. That means the kidney itself now is now strictly infected by the bacteria. There's already a septicemia. But many times, we don't really wait for this to happen. Because just like the way I said it, the urinary tract usually begins from the lower part, from the urethra. It migrates to the bladder, to the ureter, the ureter, which is a very long channel.
So it's just a long
exactly.
process.
Usually it moves from the lower part to the upper part. And like as I was saying that, the laboratory has a role to play for the diagnosis of a urinary tract infection. But when somebody comes down with the symptoms, there's a need to initiate or start treatment while we await the laboratory infection, because we wouldn't want the complication to come up.
But you know, we live in an environment where people self-medicate.
Yes.
You know, once somebody is feeling some itchy there, some burning sensation, the next thing is, toilet disease. And the person is running to the nearest chemist to get antibiotics and all of that. You know, so let's quickly talk to such a person here. When he or she is having that kind of sensation, exactly what that person should do. Rather than running to one chemist store or the other, you know, what the person should do and do quite urgently before the other big challenges that are coming in. Okay,
the urinary tract infection might look very small, but I tell you that if the urinary tract infection is not well treated,
it's something that is usually very that is always ignored.
It's always ignored.
Particularly young girls who are in the hostels.
Yes, they just feel pain, they just go take antibiotics. But then the kind of laboratory investigation that we do is culture and sensitivity, because there are very microorganisms that are responsible for urinary tract infection. Escherichia coli is the most organism that has been incriminated for urinary tract infection. Escherichia coli.
And that is what?
It's a type of bacteria that is responsible for urinary tract infection.
Doctor, you're breaking my head this afternoon.
Yes, other than the Escherichia coli, we have the Staphylococcus apophyticus, we have the Staphylococcus epidermidis, we have the Proteus, we have the Pseudomonas aeruginosa. So these are microorganisms. And when we do a cultural sensitivity, the cultural sensitivity will actually tell us the organism responsible and the antibiotics that will specifically act against this organism.
So it's not just anyhow, anyone you just pick.
Because when you take antibiotics for the treatment of urinary tract infection, anyhow, you see that you might become resistant to that antibiotics.
So is this something that reoccurs even after treatment?
Yes, there are recurrent cases. For example, we have risk factors for urinary tract infection. I did say earlier that anything that is capable of causing obstruction within the urinary tract that will cause urine to become stasis or something that is capable of causing increase in residual urine. In fact, the bladder it's not possible for the bladder to be completely empty. The bladder is not completely empty.
So the bladder ought to be completely empty.
At any point, what I'm saying is that there is always a small amount of urine in the bladder. But if at any point in time, this residual urine, we call it residual urine, that is the normal urine that must be left in the bladder. If at any point in time, anything is capable of causing obstruction that will allow the urine from coming out, of course, this person is predisposed to urinary tract infection. For example, pregnancy is a risk factor for urinary tract infection. Then anything that is capable of causing bladder outlet obstruction, for example, somebody that has a tumor or somebody that has a form of a callus within the channel, maybe the ureter, or maybe a stone, you can see that this person will be predisposed to urinary tract infection. So neurological problems, for example, you can see somebody that has a neurological problem like multiple sclerosis. It's a disease that affects the myelin sheath. It's a neurological problem. You know, it is a CNS brain problem. Somebody that has stroke, for example, such person might not be able to void urine, because for to void urine, it has to do with sympathetic and parasympathetic reflex. There must something that must send a signal for you to feel the fullness of the bladder. But some person does not have this signal
at all.
So because of that, that bladder tends to, gather urine, and the urine is a good culture medium for bacterial growth because of what it contains: the ammonia, the urea, the creatinine, which are the breakdown of
what about some persons who have this habit of holding their urine? They are pressed.
Exactly.
But, for some certain reasons, I don't know, maybe the environment is not good enough, or where they find themselves, they cannot easily find access to, like,
such person, of course, are also predisposed to urinary tract infection. Yes.
And a lot of women do that.
Yes, that is why we might have recurrent cases. that even when you treat a urinary tract infection, there's a tendency for it to surface. That is somebody that has that ability to, for one reason or the other, they tend to, voluntarily, stop
themselves into
exactly. So there's they are predisposed to urinary tract infection, and other than that, even in the hospital, patient might even come down with urinary tract infection, like somebody that has an indwelling catheter.
That is,
somebody that is unable to pass urine. Then you now have to pass a catheter, in form of an assisted way to allow urine to flow out. Yes, the pipe, exactly. So you see that the process of fixing the pipe, you will probably push organism from the lower part to the upper part.
Okay.
So you can see, so the person might acquire this kind of hospital,
but it's treatable.
It's treatable. Exactly. That's the beauty of it.
If only the person can talk about it on time to the doctor.
Present on time, because the complications of urinary tract infection are the morbidity is very high. It may result to kidney damage, chronic renal failure, the pyelonephritis, from the lower part.
That is this UTI that a lot of us take as ordinary.
Exactly. It might
cause all of this.
It might result to urethral stricture. So what it means is that when somebody has a urethral stricture, the person might not be able to
urinate,
pass urine anymore. And the urethra is also a pathway for sperm that is required for fertilization. So it may, if there is a urethral stricture, that might cause infertility other than the kidney damage. And many a times when you overlook a urinary tract infection, you just feel that, oh, it's just one of those things. You feel pain in your burning sensation while you are urinating. Okay, or you feel
let's say if we have a call or two, the number is 052-290-573. Do not take your urine for granted. If you're pressed, look for where to ease yourself. But it's just that for women, it's not so easy. For a man can just jump out of his car on the road and just do his business. But for a woman, because of the nature of her body, it's not so easy for a woman to pass urine. But you must try your best possible to look for a place, a convenient place to, get it out so that you don't create problems for yourself. 052-290-573 is the number to call. Peradventure, you are experiencing any of these and you have any other question you want to ask the doctor, please do. Because I know a lot of persons are surprised that UTI, as small and as simple as it looks, can actually damage the kidneys, which would not be too good. Okay, so doctor, let us look at treatment. You did say that it depends on the results from the lab when somebody goes to the lab, to do a culture test and all of that. Yes. So let's start with the first aid treatment. What can one do if you notice this, Maybe where there's no doctor, you just quickly want to run to the pharmacy and, do something for yourself as first aid.
Yes, if there are symptoms pointing towards a urinary tract infection.
Okay, before that, let's do the symptoms again for that person that didn't start with us.
Yes, there's increase in urinary frequency. There's painful urination, what we call the dysuria.
Then what about burning?
That's the burning sensation while passing urine. Okay. That's the dysuria. There is this increase in desire to pass urine, which is urgency. There is passage of cloudy, offensive urine. There might be blood in urine, what we call visible or microscopic hematuria. The blood might not be visible, but it might be detected in a laboratory. So it's a pointer toward urinary tract infection. Okay,
so if you have any of those symptoms, I think you should give Dr. Jolly a call. All right, doctor, let's look at first aid first.
Yes, the first aid in urinary tract infection includes taking water. When you take plenty of water, we encourage that. But for somebody that has dysuria, it might not be comfortable for them. What I mean is that when you take water, your kidney will have to liberate the water out of your system.
Definitely.
So the process of passing urine, you still feel this burning, painful sensation. So that might be uncomfortable. But then taking water is a good measure in trying to wash out those bacteria through urination. And as a prevention too,
yes,
most persons usually they sexually active women. Because UTI is very common in women.
Is it sexually transmitted?
It's not sexually transmitted, but during sexual intercourse, the urethra might be slightly injured. This one will cause it to be predisposed. This one will create an opening for organism to move from the perineum. The perineum is the, that's between the anus and the female private parts. That is the perineum now.
That's between the anus and the vagina.
Yeah, exactly. That is the perineum we're talking about now. So when there's an injury in the urethra in female, maybe as a result of sexual intercourse, there is bound for an organism. Organism might move from that anal region now down to the urethra.
Has to be very careful when doing her business.
Exactly. So that is why sometimes there's what we call the the honeymoon urinary tract infection.
I think we have a caller. Your honeymoon, okay, that's wonderful. Hello, caller. Good afternoon. Good afternoon, madam. How are you? Okay. Go ahead. Hello. I can. If it's good
in the night twice, during the day twice, like 3 times in the day, then in the night 2 times. Is it normal?
Okay, doctor, is it normal for a woman to urinate like 5 times in a day?
To urinate 5 times in a day is normal and is not also normal. Let me explain it this way. In a cold weather, for example, where you don't lose water through insensible means. Insensible means losing water through sweating, through breathing, these are ways with which you lose water from your body. Because the food that you eat, the water you have taken have to be catabolized, and be liberated out of your system. So in a very cold weather, you might not be able to pass this insensible water loss. Instead, you compensate by passing more urine. You can pass urine up to 3, 4, 5 times in a day. But by the time it becomes a recurring thing, it becomes a problem. Even when the weather is hot, it becomes a problem. So there's a need for you to go for a laboratory investigation. Because like I said earlier, we cannot say that for the fact that you pass urine up to 4 or 5 times a day is a pointer towards urinary tract infection. There are other causes of increase in urinary frequency. For example, somebody that has diabetes mellitus might pass urine up to 4 or 5 times a day. Might even pass urine more at night.
5 times.
Yeah, exactly. If somebody that has diabetes insipidus might also pass urine frequently. Even in male, for example, somebody that has prostatic enlargement, like the one I said, benign prostatic hyperplasia, that is common among men, that is 40 years and above. You can see that they can pass urine. You can see when you go to the laboratory or when you meet a doctor, we'll be able to analyze to know the exact cause of this increase in urinary frequency. Okay,
so it's best for her to go to the hospital and see a doctor.
Exactly.
All right, madam, you kindly see a doctor. Hello, caller, good afternoon. Hello. Hello, good afternoon. If you reduce the audio level on your television set. Hello.
Hello, good afternoon.
Good afternoon. Reduce your audio level, the audio level on your television. Yes, good afternoon, madam. Reduce the audio level on your television set, please.
Okay. I want to ask, there's injury in my leg.
Injury, yeah.
Yes, can I take a picture? I'm a nursing mother.
And you have injury?
Yes.
What is the cause of that injury?
I don't know.
You don't know?
For how long has the injury been there?
For almost 3 years, we go and come back again.
Okay,
I will advise this woman to see a doctor. You can see that this woman, for an injury to be there, you are a nursing mother, and you said the injury has been there for 3 years.
It goes, it comes.
Exactly. Whether you are a sickle cell patient, though I've not asked you that, whether you are a diabetic patient, whether you are immunosuppressed, there are conditions that will make an injury not to heal on time. So we have to evaluate and know the exact cause. If possible, we can also do a wound swab. We take a part of the wound and take it to the laboratory. So it will tell us the organism that is causing the infection and causing that injury not to heal. Then we can know exactly how to treat.
So the doctor cannot say this is the drug to use or not. But just stay on the program, okay? As we're rounding off, I will call a number for you. You can use that number to do a follow-up, all right? 052-290573 is the number to call. Call the doctor, ask a question, and then you say you'll be happy, okay? So, Doc, while we're waiting for... Okay, hello, caller? Hello? 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 I can actually hear you, okay? So when you are calling us, try and reduce the audio level on your television set, or you move away from where your TV is, okay? Hello? Hello? Hello?
Hello?
Yes, good afternoon.
Hello, good afternoon, madam.
Good afternoon. Please, what's your name?
Okay, this is Prince from Upper.
Okay, Prince from Upper. All right, Dr. John is waiting for your question.
Okay, please, I want to ask the doctor if I'm going to... Hello?
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 Hello, I can hear you.
Can you hear me?
Reduce the audio level of your television set so that we can talk properly.
Okay. So when I go to toilet, then
When you urinate, when you go for urination, your blood comes out, Abby? Okay, when you toilet, okay.
yeah, the blood will be coming out.
Okay,
The water system will be blood.
okay,
Blood inside.
okay. So you want to know...
Do you feel pain while you are going to toilet too, apart from the blood that you are seeing?
You said?
Do you feel pain other than the blood that you see while you are going to toilet?
Yes.
Okay, I will advise you to see a doctor. It might just be an hemorrhoid, because at the primary stage of hemorrhoid, what you just see is blood. There might be no protrusion, as in you might not see anything coming out from your anus. And apart from the hemorrhoid, it could also be an anal fissure or an anal fistula. However, I advise that you see a doctor that will evaluate you and know the exact cause, and that will treat you.
Okay, thank you. Thank you very much.
Okay, thank you for calling, Prince. Hello, caller. Hello? Hello? All right, while we're waiting for more calls, time is really not our friend. Doctor, can you quickly talk about the treatment?
Yes, the treatment of urinary tract infection is just a simple antibiotics. But that's not to say that when you have a urinary tract infection, you just buy
swallowing
and the commonest antibiotics people usually go for is ampiclox. And unfortunately, Nigeria is the only country where you just go to a chemist or a pharmacy, you just buy without prescription that you put in your mouth. You see, this antibiotic that you take without prescription might become resistant in such a way that when this antibiotic is not needed, it might no longer work for the purpose it's supposed to do because of the self-medication. Because the organism that you took the ampiclox for is not resistant to it. You have made them to resist,
to be strong.
To be strong, exactly. That is the effect of self-medication. Okay. I did say earlier on that the best medication, the best way to go for a patient that has a urinary tract infection is to do a urinalysis, is to do a microbial culture sensitivity, to know the exact organism responsible and know the medication, the antibiotic that is sensitive against this microorganism. Okay. Then the patient will be sure of cure.
So it's curable.
It's curable.
But when you don't attend to it on time, it becomes problematic.
It becomes a complication.
Okay. All right. This is all time will permit us to do today on the program Healthy Living. But don't worry, we'll see you again next week. But before then, you can call. I know a lot of persons want to call, and this is the number to reach us on to do follow-up. You call 080-3472-1750. The number again is 080-3472-1750. Call this number and you will be able to discuss at length with the doctor. I'm Adisa Walsa Wagia. Thank you very much for watching.